name is Dena, and this is my policy speech for speech class. My purpose is to persuade my audience the need for mandatory drug testing for welfare/public assistance recipients. Should America foot the bill for drug addicts on public assistance? I think not. I believe it should be a policy to test new applicants who are applying for public assistance and randomly test those who are already receiving assistance from the government. According to National Conference of State Legislature, at least 36 states put in proposals in 2011 to drug test recipients. 3 states passed legislation in 2011 to drug test recipients, and 4 states have passed legislation in 2012 to drug test recipients, bringing the total number of states to 7. In 2012, Utah passed legislation requiring applicants to complete a written questionnaire screening for drug use. Georgia passed legislation requiring drug tests for all applicants receiving temporary assistance for needy families. And Tennessee approved a bill to require substance abuse testing for all applicants. Oklahoma passed a measure requiring all applicants for TANF to be screened for illegal drug use. According to an article called Rates of Illicit Drug Abuse in the U.S. by Buddy T. from About.com, an estimated 20.4 million people in the United States used some kind of illicit drugs in the past 30 days. According to the latest government statistics, about 8.3% of all persons aged 12 and over are involved in the use of illegal drugs or the non-medical use of prescription drugs. In an article called Millions of Americans in Denial About Drug Abuse from the website Substance Abuse and Mental Health Services Administration, overall, the household survey found that 15.9 million Americans aged 12 and older used an illicit drug in the month immediately prior to the survey interview. According to CNN Money, more than 1 in 3 Americans lived in a household that received Medicaid, food stamps, or other means-based government assistance in the mid-2010 year. According to a new report, and with Social Security, Medicare, and unemployment benefits included, nearly half of all the nation lived in a household that received a government check. That's more than 148 million Americans. The number of Americans dependent on the federal government has exploded over the past 5 years, reaching a record of 67.3 million people, according to Heritage Annual Index of Dependence on Government. That means that 1 in 5 Americans, which is 21.8% of people today, receive some level of assistance from the federal government. If you do the math, based on all of those figures, millions of Americans who are receiving government funding are also using and abusing illicit drugs, using their welfare money to foot the bill. Having restrictions may encourage drug-addicted people to get help with their problem. If parents of teenagers and young children make a change to get help, there may be less child abuse and neglect, which in turn could change the outcome of our society. I ask you to concede my point regarding the importance of drug testing people who are getting or trying to get public assistance. If people are willing to take a UA for a job, they should be willing to do a UA for free money from the government. Thank you.